Thank you, Mr. Chairman. Yes, we could do that.
Okay, you are recognized. I know Representative Dennis has been here patiently waiting, so you are recognized on the bill.
Thank you. I thought he had fallen asleep. Thank you. Senate Bill 666, and it would seem that the number designated for this bill is ironic at best. So this bill would prohibit Tennessee insurance companies from selling health insurance on a federally created health insurance exchange. Mr. Chairman, there are two amendments, one which is just a one-word change, and the second is a little more substantive. But members, Tennessee has already rejected the creation of a state-run exchange, and just today we rejected Medicaid expansion. However, the federal government is hard at work nonetheless, creating its own exchange in Tennessee that it plans to run here in our state, that if implemented will borrow billions of dollars from our children's future to subsidize insurance policies. Normally, we as a state legislature are unable to stop the federal government from its borrow and spend nature. However, this is one of the rare instances where we can actually stop the federal government from borrowing billions from our children. The Patient Protection and Affordable Care Act, also known as Obamacare, provides tax credits that reduce premium costs to citizens and legal residents in families with incomes between 100% and 400% of poverty level who purchase insurance through a health insurance exchange. People with incomes up to 250% of poverty also are eligible for reduced cost sharing, for example, coverage with lower deductibles and co-payments. And these are paid for by the federal government. The premium tax credits and cost-sharing assistance will begin in 2014. In a few minutes, I will pass out a handout which will give you the timeline on Obamacare for the next few years. The Congressional Budget Office estimates that the direct cost of premium and cost-sharing subsidies to be $350 billion from 2010 to 2019 and $8 billion in indirect costs. Normally, if the federal government takes over an industry or area of law, they take regulation of the industry away from the states. However, the Achilles heel of the Affordable Care Act lies in the fact that the federal government specifically left regulation of insurance companies to the respective states. In doing so, they have left the door open for states to regulate how, when, and where health insurance policies are sold. Although we cannot stop the federal government from creating an exchange, we have complete authority to regulate the companies that would sell on an exchange. The proposed exchanges would take business away from locally owned insurance companies and push some of the most vulnerable citizens of our state into an online bureaucratic system with no incentive to assist in finding the right policy for their family. This is unfair, and it is truly unacceptable. This is our opportunity to protect our local insurance agents and business owners as well as the citizens of our state, and to stop the federal government from borrowing billions against our children's future. Mr. Chairman, if I may, if we could go into recess, if there are any questions, Representative Dennis from the House, who brought me this bill and which I was thoroughly engaged in and embraced, is here present to help with any questions.
Madam Chairman, we can go into recess now if there are no objections and bring forward whomever. So if you'll ask.
So, Representative Dennis.
Please come forward, sir.
Mr. Chairman, there are two amendments, just as a point of information, I understand we're in recess.
Go ahead.
But we'll go right ahead.
Come forward, sir. Do you want to move an amendment and then
I'd move the bill.
Okay.
And ask for a second.
So we'll come out of recess and move the bill.
Move the bill.
Is there a second on the bill? We have a second. We've got it before us, and we'll go ahead now and go out of recess then. Chairman, is that what you'd like to do? And have the or go into recess, I'm sorry, and have the, okay. We are now in recess, and sir, if you'll make sure the light is on in front of you, state your name for the record, and we'll give you about 5 minutes. Just make sure that button, there you go.
Thank you, Mr. Chairman, Senators. Vance Dennis, State Representative for the 71st House District. I've been working diligently on this bill with my good and esteemed Senate sponsor, Senator Gresham. This bill is a product of several months of work and on my behalf, analyzing the Affordable Care Act, otherwise known as Obamacare, trying to find out what we could do to slow it down, to basically to stop the situation that we're in, where the federal government's going to borrow billions and billions of dollars from our children with no plan to pay it back to meet our current needs. This bill is a product, or in my opinion, it is the best way I can come up with to stop it. And the reason for that is because the federal government tried to have its cake and eat it too. In the preemption language of the Affordable Care Act, there are several sections dealing with preemption of certain issues in regards to insurance, but they seem to go out of their way to leave states in control of their own insurance industry and the insurance and the field. To the extent, basically, most of the preemption language says to the extent that states can regulate completely, except to the extent that it completely undermines the federal act. The preemption language is ambiguous. It's not clear at all, and I anticipate a number of legal challenges on the preemption issue, and that's kind of the reason we're here. We have the ability, as state legislators, in passing this bill, to make the federal government bring the fight to us. If we pass this bill, there would have to be a legal challenge brought to determine what the preemption language is and what we can and can't do when it comes to regulation. I'll throw out a hypothetical. If the state were to pass a statute that completely eliminated insurance companies in the state, would the feds try to argue that we couldn't do that because it undermined the Affordable Care Act? I don't know, and nobody else does either, because this is new and it's extremely ambiguous. My personal position is anytime we have the ability, it's very rare when we do, but anytime we have the ability to take the opportunity to save our children billions and billions of dollars being borrowed against their future with no plan to repay it, we should seize that opportunity. And I would respectfully request that you support this bill, and I'll be glad to answer any questions that I possibly can.
Thank you. Mr. Chairman, you have a question?
I do. Thank you. And thank you, Representative, for being with us. How does this play out? We passed this. So this means that an insurance company that's licensed in Tennessee cannot participate in the exchange?
That's correct.
But could an insurance company that's not licensed in Tennessee, can they get authority through the federal government to come in and provide those services in the exchange?
Absolutely not. The Affordable Care Act is very clear. Any policy that is sold on on an exchange, be it state or federally created, has to be licensed by the state in which that's being conducted. They were extremely clear on that. There is no way I've found, and nothing has been provided to me by anyone to the contrary, to say that there's any way they can. I think the federal act is very clear. No out-of-state, unlicensed insurance company can sell insurance on an exchange in Tennessee the way the law is currently written. If Congress changes that, then, and they certainly have the ability to do that, they could completely take over the industry if they chose to. But the way the law is currently written, it can't be done. The company has to be licensed in this state, and like I said, Congress could change the law, but right now I don't think Congress could pass a bill to decide what they're going to eat for breakfast tomorrow, much less pass a bill that changes this to the significance that this would entail.
So you assert then passage of this bill, and should it become law, then the exchanges don't get created.
The exchange would get created. We can't stop the federal.
There would not be any insurance companies to serve.
Exactly. An analogy would be the federal government can build a flea market somewhere, but they can't make vendors come and sell at it, and that's the issue. They have set up an exchange, a marketplace. They can't make people come and sell there. If no insurance company determines that they can make money and sell a product on this exchange, then nobody sells on it, and it's just it's a market with no vendors, and that's essentially, in my opinion, that's where we're at.
Okay. And Mr. Chairman, obviously not there'll probably be others, but I'd like to hear from the insurance industry too at the appropriate time. Thank you, Representative.
If you don't mind, there may be some other questions of you, sir. Are there other questions from Mr. Speaker?
I'll yield.
Mr. Chairman.
Just help me here. The one concern I have with this bill is, aren't we getting into an area? And I'm, first of all, for the record, I opposed the Affordable Care Act, disappointed it was passed, and surprised and distressed that it wasn't completely ruled unconstitutional. That said, I have a problem with what I think is we're trying to micromanage local business, insurance businesses here, to tell them, is that an appropriate role for us to tell the private business what they can do and can't do? I'm not for the Affordable Health Care Act, but I just have a concern about that. Could we be swapping a headache for a stomach ache here? Help me out here.
In my opinion, no, because if this bill passes, every insurance company licensed to do business in the state will be able to do business in exactly the same manner they do right now. Nothing would change. You'll still have insurance agents in every small town and community across the state selling an insurance policy to any customer who comes and asks for that. All this bill will stop is this federal bureaucracy and this new marketplace that the federal government's creating and subsidizing with billions of our children's dollars. But they can still conduct business exactly like they do today. Every insurance company in this state. I don't think it goes any further than where we are today by any means as far as regulating the insurance industry, which we do, for good or bad, regulate extensively in the state.
Thank you.
Other question, Mr. Speaker?
Yeah, I'm trying to understand, and thank you, Mr. Chairman. Is this good policy or is this good tactics?
I believe it to be good policy myself.
Okay, so you would oppose, you think exchanges, whether they're constructed by the private sector or whether they're constructed by a government entity, are bad policy? No,
an exchange in and of itself, in my opinion, is not a bad policy at all. If the state set up just a purely an exchange, I'd rather it be a privately set up exchange as opposed to the government, but an exchange purely on its face is not a bad thing. Building a marketplace, if that'll help customers get to that product, is not a bad thing. The problem that I'm trying to address, and it's a fundamental problem, is the subsidization with billions of dollars of our children's money of these policies. Anybody that's the way this exchange is set up, anybody between 100 and 400% of the federal poverty level is going to be getting money from our children to subsidize that policy. That is the issue that I take great challenge with, because my boys are 5 and 7, and they're going to come to me in about 20 years and say, what did you do to stop the federal government from borrowing and borrowing and borrowing all this money against our future? I'm not going to be able to sit with a straight face and tell them, I hope to be able to sit with a straight face and tell them I did everything I possibly could, and that's why I'm sitting here.
Because you said in your introduction, you said that this was a method to create a legal challenge to the law, which sounds like a tactic and not a policy to me. So is it good policy to create policy in order to create a lawsuit? Is that good policy or is that a tactic?
The intent is not to create the lawsuit. The intent is to affect policy. Now, and my hope would be that a lawsuit didn't arise from this, but my guess is that the federal government might bring a legal challenge to prevent this statute from being implemented. If they did, the court would have, absent injunctive relief, as this case worked its way through the system, we could stop for the next few years billions of dollars being spent on this exchange, regardless of the ultimate outcome of a legal challenge. So my intent is to affect the policy and stop the spending of those billions of dollars in any way I can. That's the policy issue. I think we do it with the bill. I think if there's a legal challenge, so be it, but it's a policy position for me.
Okay, two more things, Mr. Chairman, with your indulgence. Yeah.
Mr. Speaker, go ahead.
Do you oppose federal transportation funding as well?
not as a general rule. I take issue with borrowing money to pay for transportation needs. We have an unbalanced budget to the tune of $1 trillion. I don't support us continuing to borrow money as a country with no plan on paying it back. So to the extent federal transportation dollars are borrowed from China and borrowed against our children, I don't support that. But those tax dollars that are paid in are ours, and they're for our roads, and I certainly support us using those for infrastructure. I don't support borrowing $1 trillion from China to build those roads.
And Mr. Chairman, for the record, I oppose the Affordable Care Act, and as my chairman of state and local alluded to, I would have preferred to see the Supreme Court strike this down. I also oppose the federal government borrowing over 40 cents of every dollar that we have. What I'm concerned about with this particular bill, and I would ask members to consider, is whether this is good policy or whether this is simply a tactic. Now, it may be a good tactic. It may be very, very wise strategic maneuver. But let's be honest about whether we're talking about good policy for the state, whether we're talking about good policy for the citizens of the state who have no part in this. This is a decision that was made at the federal level and imposed upon the state. Whether it's good policy for the insurance industry in the state of Tennessee. And I would remind the sponsor, as I did in the hallway, in the late 1920s, Smoot-Hartley was an act, a tariff that was passed with the intent of a protectionist intent that would save the United States from the Depression. In all its great fanfare, Smoot-Hartley only extenuated the problem and made the Depression worse. And so I want to be clear that as we debate this bill, Mr. Chairman, that we debate the policy aspect of the bill, not whether this is a good strategic maneuver that at the end of the day, with unintended consequences, hurts not only the citizens of the state, but hurts an industry in this state that, quite frankly, is one of our largest economic engines. And with that explanation, thank you, Mr. Chairman.
Mr. Speaker, thank you. Are there any other questions of the representative? Let's have the other opposing side come forward, please. Thank you so much, sir. Again, I know you gentlemen know the routine. If you'll make sure your mic is on and tell us who you are for the record. Thank you.
Yes, sir, Mr. Chairman. David Bromell. I represent America's Health Insurance Plans, the trade association for many of these companies in the room. I also represent the Tennessee Association of Health Underwriters, who are the men and women that are insurance agents in this state. And if I may, do you want me to go ahead or introduce the
You might as well go ahead, sir,
Okay.
and then as the other individuals are ready to speak, they can tell us who they are. Thank you very much.
And let me say, I respect very much what Senator Gresham, the sponsor, is intending to do with this legislation, but I want to follow up with what Senator Watson said. There are at least two unintended consequences, and very important unintended consequences you need to know about if you vote for this bill. First, the health care exchange and the Affordable Care Act gives Tennessee citizens that participate in an exchange not a subsidy, but actual tax credit. So these are tax-paying citizens, Tennessee citizens, that will get a tax credit to reduce their insurance premium. And so you will deprive those citizens of the ability to purchase insurance at a reduced cost. It is true, as Representative Dennis said, that the insurance companies can sell outside the exchange, but those Tennesseans will not receive a tax credit. The second unintended consequence you're going to do will be to deprive Tennessee insurance companies of the opportunity to participate in the exchange, and I don't believe that the federal government is going to allow the exchange to go unstaffed. The way the law is written now, that the HHS has the ability to define what a qualified health plan is, a QHP, and for the time being, they're going to rely on the commissioner to screen insurance companies and admit and allow Tennessee companies to become QHPs, but that may change, and I submit to you that it will change, and there are plenty of other companies that abound who are not Tennessee licensed that they'll simply use because they're not going to allow, that's the crown jewel in the Affordable Care Act, the exchanges, and I don't believe they'll allow Tennessee not to have an exchange. So thank you. Any questions on that?
Okay, thank you, Mr. Bromell. Mr. Lott?
Thank you, Mr. Excuse me. Thank you, Mr. Chairman. David Locke, Blue Cross Blue Shield of Tennessee. Obviously, we're opposed to this legislation. Since 2010, when the Accountable Care Act was passed, we've been drinking from a fire hose. We have spent millions of dollars trying to and working toward complying with the Accountable Care Act, and thousands of man hours and woman hours to do such. The bill passed both houses. The bill survived a constitutional challenge with the United States Supreme Court, and the President of the United States was reelected. So we're pretty sure this is the law of the land, and we're moving forward. I like the analogy of a marketplace, whether it be a flea market or not. We're a vendor, and we want to put our goods on that marketplace and have an opportunity to compete for customers to buy a product we might have there. This is, when you look at where there's growth, where you can actually go and maybe get new members, this is where the growth opportunity is. So we very much understand as Mr. Bromell said, the feelings around this. We really don't want to be penalized for just trying to go out there and do what we do. We are a Tennessee-based company. We were created in 1945, headquartered in Chattanooga, Tennessee. We are the largest private employer in Chattanooga. Have offices all across the state, and our biggest concern with this is, and I believe the amendment will probably address this, is that if there's any crack, any loophole in this bill, and someone figures out, or whether HHS or CMS or Congress figures out a way to wedge in a competitor to come in and actually start selling on an exchange, selling an exchange product in Tennessee, we would be prohibited from competing to keep our members, because what it will do, it will take folks away from who we might be who might want to buy one of our products, and that will have a serious economic impact on us. We feel so.
Okay, let's hear from Ms. Young.
I'm Baton Cleanup, Senator Johnson, Chairman Johnson, Mandy Young on behalf of Cigna again, and just 2 points. We, like the Blue Cross Blue Shield, we employ 3,700 people in the state. We're committed to the state of Tennessee like many other states, and we believe the federal exchange is a place that we are very interested in doing business. Representative Dennis and I have had a nice little law debate about whether this state can pass this law and whether it's really going to preempt us. I will read to you, my Farm Bureau friends have shared something with me. It's from the Federal Register, and it's a comment under the rules and regs. It says, states regulate health insurance coverage. States would continue to apply state laws regarding health insurance coverage. However, if any state law or requirement prevents the application of a federal standard, then that particular law or requirement would be preempted. Cigna's legal counsel, national legal counsel on this issue, who is not here, I am their representative, would believe that this is going to be preempted by the federal government. And in the process, you're doing that. You're punishing us, Cigna, Blue Cross, and other companies that may want to participate on the exchange. We understand the visceral reaction to Obamacare. The chairman and I have had long discussions about that. We understand that you're opposed to it, but you're taking business away from each of our companies if you pass Senator Gresham's bill, because we won't be able to sell to Tennessee residents that want to buy insurance on the exchange and take advantage of those tax credits, and then pay premium tax in the state of Tennessee on that policy. So that's all I have, Mr. Chairman, unless there are questions.
Okay, questions for the witnesses? Okay, seeing none. Thank you.
Well, Mr. Chairman, Mr. Locke reminded me the Attorney General has backed up with what Ms. Young said, that he believes such a law wouldn't survive a constitutional challenge.
Okay, thank you. Thank you. And, sir, I'll give you 2 minutes, okay? If you will, state your name, please.
My name is Ashley King. Can you hear me?
Turn on the microphone there.
My name is Ashley King, and I'm from Memphis, Tennessee, and I'm a citizen of the United States of America. And unlike many people on this committee, I support the Affordable Care Act. And I think it's a great thing for the United States. And I respectfully ask this committee to kill Bill 666. The state of Tennessee has spent a lot of money examining and planning with for the exchange. In 2011, there was a report, and I emailed it all to every member, that the state of Tennessee produced. And the Tennessee stakeholders expressed in writing their preference to a Tennessee exchange. The group included all major insurers, both major associations of brokers and agents, Tennessee Medical Association, Tennessee Nurses, Hospital Association, Independent Business, Tennessee Primary Care Association, American Cancer. No one indicated that they did not want an exchange. Tennessee workers are encouraged to join the exchange by having voluntarily healthcare providers forgive medical debt when a family joins the exchange. Bill 66 kills this opportunity for hardworking Tennessee families and their children. Although Bill 66's physical note reads not significant, not foregoing medical debt is a real, too real physical impact on Tennessee families. Beginning January 1, Tennessee families will be required to have insurance. Not doing so will mean that they have to pay a penalty. Beginning 2014, all Tennessee employers will face penalties if they're not in compliance. Will Bill 66 pay those penalties for the hardworking families of Tennessee and businesses? I don't think so.
Mr. King, I'm sorry. Drop to a conclusion, please.
All right. In conclusion, I respectfully submit that this committee should kill Bill 66. Hardworking families and businesses in Tennessee can't afford it. Thank you very much.
Thank you, Mr. King. Okay, and very quickly from the department.
Mr. Chairman and committee members, I'm Charles Snyder, liaison for Commerce and Insurance, and we're just obligated to, we've had some conversations with a lot of you, but the governor did issue a philosophical flag on this bill, and we do not disagree with many of the things that Senator Gresham and Representative Dennis said. We are not a fan of the Affordable Care Act at the department as well, and we will enforce whatever laws and policies you put in place, but this just gives us some great concerns in closing our market and making it unfriendly to health insurance in Tennessee.
Duly noted. Denise?
One comment I might add, and I think that Mr. King touched on it, not only Dave Bromell mentioned the tax credits that many individuals would forego. I think one of the unintended consequences would be that no Tennessee companies could sell in the state of Tennessee on the exchange. People are required to have insurance, so then they're going to be penalized financially.
Okay.
And that concerns us as well.
Okay. Thank y'all. Duly noted. Okay, we'll go back into session. If there's no objection, we'll put the question, and I'll allow Chairman Gresham to close, or Speaker Watson.
Thank you, Mr. Speaker. I would like the sponsor, because I am really, I get the intent of this, and I hate the Affordable Care Act, not only from a policy perspective, but just from this kind of turmoil that it's caused and the potential damage it will do to our healthcare system. But all that being said, it is the current law. Supreme Court has upheld almost all of it. And so I would like for the sponsor to help me understand the policy position that she is taking on this and why restricting access to a market is good public policy for the insurance industry and for the citizens of the state, because ultimately we should be dealing with policy and not necessarily tactics or strategy.
Chairman Gresham.
Thank you, Mr. Chairman. We haven't gotten through the entire process because I had an amendment.
Oh,
to
you
go.
did. That's right. And
Yeah, had
my
an
apologies
amendment,
on
which
that.
is 5795. And
Okay.
if we could take a look at that amendment, that's not on your iPad. That was passed out just this afternoon. And let me just read over that so it becomes clear about what the amendment does.
And did we adopt the First Amendment?
No, this is the
This is
amendment.
the only amendment.
This is the
Okay,
amendment.
thank you. You're recognized, Chairman Gresham. Thank you.
Thank you, Mr. Chairman. So what we have here is, as the amendment reads, and this makes the bill, no individual or entity, whether unlicensed, licensed by this state, licensed by any other state, or licensed by the federal government shall offer, sale, solicit, or negotiate any health insurance product to the citizens of this state on any state, federal, or federally facilitated exchange authorized by Obamacare. Now, if I may discuss the amendment, which makes the bill. First, on the question of policy. Certainly, this is a policy that's been developed to protect consumers, to protect Tennesseans from premiums that are anticipated to rise 61 to 100% in the next few years. And I get those numbers from the Heritage Foundation, which did a complete study of Obamacare. So on this exchange and through Obamacare, the premiums will be subsidized. Truly, it'll be subsidized by borrowing money, and we'll be paying it with money that's on our children's backs. So it is a question of policy to protect Tennesseans from that kind of unfair situation. The insurance companies in Tennessee will continue to operate as prosperously as they do now. They just won't be able to do that in that particular marketplace that we call the exchange. So the important thing here is that those products will be subsidized. Will be subsidized by money that we don't have, by money that the federal government doesn't have. That is the whole point. There is no money to pay for this. We're borrowing it, and the dollars that we're borrowing it will have Mao's face on it. And that's the point. So the amendment, again, 5795, which makes the bill, makes it clear that whether or not you are licensed in this state or another who wants to come into Tennessee, when they find that insurance companies that are licensed in Tennessee will not be able to participate in the exchange, this levels the playing field for anyone. Our insurance companies in Tennessee can continue to operate as prosperously as they have in the past.
Okay. Chairman Gresham moves the amendment.
Yes.
Okay. Chair will second to get it before us. So we're on the amendment. Speaker Watson.
Thank you, Mr. Chairman. Is it your argument that by restricting Tennessee insurance companies from being on the exchange that you will lower the cost of insurance? Is that your argument? Because you made the argument that having insurance companies on the exchange will result in a 61% increase in premium. So is your argument by not allowing Tennessee insurance companies to operate on the exchange that you will see a reduction in insurance rates in the other markets?
I have never in my adult life seen insurance rates lowered. I have seen them perhaps not accelerate as fast as they might have, but not lowered. So I'm not looking for a reduction. I'm looking for a control. And to keep...
I'm sorry.
Try. No, I'm through.
But I guess I'm just trying to understand your argument because you brought up the 61% and you've tied it to the Tennessee insurance companies being on the exchange. So is it your argument that by Tennessee insurance companies not being allowed to participate on the exchange, that it will control the rise of insurance rates?
Yes.
Can you expand on that? And then I'll yield, Mr. Chairman, how that occurs?
That you will not have the subsidies. As long as you have subsidies, you're going to see premiums increase. And the subsidies are being paid by the federal government, who doesn't have any money, and they borrow it or print it.
Okay. Thank you, Mr. Chairman.
Thank you, Speaker. Okay, we're on the amendment. Objection to the question. Those in favor of Amendment 1 say aye.
Aye.
Opposed, no? No. The ayes have it. Okay? Okay. We're on the bill. We're on the bill as amended. Is there objection to putting the question? I'll allow Chairman Gresham to close. Seeing none, the question is put. Chairman Gresham.
Thank you, Mr. Chairman. Let me just remind everyone one more time that what the federal government has done has left the door open for our states to regulate how, when, and where health insurance policies are sold. Although we cannot stop the federal government from creating an exchange, we have complete authority to regulate the companies that would sell on an exchange. Thank you, Mr. Chairman.
Okay. We are on the bill. Call the roll.
Senator Burks? No. Senator Burks votes no. Senator Green? Pass. Senator Green passes. Senator Gresham?
Aye.
Senator Gresham votes aye. Senator Sutherland? Senator Tate? No. Senator Tate votes no. Senator Tracy? Senator Watson? Pass. Senator Watson passes. Senator Yager?
Pass.
Senator Yager passes. Chairman Johnson?
Pass.
Chairman Johnson passes. We have
1, 2, and 4, the bill stays in committee.
Thank you, Mr. Chairman.
Thank you, Chairman Gresham. Members, Senator Green has asked to take up Senate Bill 1142.